And then some hygiene stuff, and then also today, um, all that stuff.
Okay, we're going. So we're gonna start. So Juan, go ahead and introduce yourself.
All right, so my name is Juan Flores, and I'm here with my group to present about sleep.
My name is Michelle.
And I'm Miriam.
And today we're going to talk about why sleep is important.
Yeah,
And
yeah.
to start off, do you guys know why sleep is important, in your opinion?
Regrow your brain.
It's repair and restore.
Prepare and restore.
Anyone else? Anyone else?
Like,
It's very necessary.
oh, body demands it after a certain time.
Yeah, yeah. Well, sleep is essential for life, for every day. So sleep is important because even though we think that it's a very quiet physical state, our brain is highly active during this time. Even though we're just laying there not doing anything, there's so many things going on in our brain. For example, we're getting physical restoration, which is our mental and physical aspect of our body is just getting restored. And the next day you will feel it because you'll be able to tell in your tiredness and just your well-being. For example, your moods are highly affected by how much sleep you get. And then the information which you process is also different when you sleep because the information which you learn during the day and even information which you don't use, you still process it at night. So it's everything that you consume goes in and out of your head. And then sleep also affects your mood regulation because the more you sleep, typically the better you feel. And the less you sleep, typically the more impatient you feel. You feel more stressed with everything going on around you. And then sleep also strengthens your immune system because you fight off toxins like I believe it's all I'm not sure which one, but you just fight off you throw out things out of your body which you don't need, things which your body knows that you don't need, and it's like a physical. Your body just knows how to do it through natural selection. You just know how to do it. Your body just lets out things which it doesn't need, and then that goes back to the theory. The idea that it clears your brain of toxins, which is we need that to survive. And then sleep is essential to every process in the body because it affects our physical and mental function to the next day.
Okay, so that's so what happens to our body while we sleep? So sleep is regulated by the part of our brain called the hypothalamus. And there are factors that affect the hypothalamus to do its function to promote sleep. So there's light, noise, illness, should be in the next slide, but so those are the things that can affect the work of the function of the hypothalamus. So have you heard of melatonin? Okay, so basically hypothalamus sends a message to the pineal gland, and then pineal gland will produce melatonin to put you to sleep. But there's more than that. So since that's why you said when you sleep, try to turn off the light because it affects the hypothalamus. So when you sleep, you want that to function, the hypothalamus. So try to be peaceful. That's when the sleep hygiene goes in play, when someone will discuss that later, but I'll go for the science. So during sleep, also the hypothalamus takes care of the body temperature, heart rate, blood pressure, and it will all drop during your sleep. And also sleep will control your hormone secretions at night and eating habits during the day. So a lot of things are going on. So let's go to the next slide and I'll explain further. So yeah, I just mentioned that the hypothalamus, and there's the orexins that help you. The hypocretins are hormones that keep you awake and alert during the day, but then at night, there's some hormones that will keep you asleep as well. So we can go to the next slide now. Okay, just like I said earlier, light, noise, pain, and illness is the one that affects hypothalamus to put you into sleep. And there are stages of sleep that we all go through, and I calculated that it's a 6-hour process. because every stage is an hour and a half at least. So has anyone here woke up with a headache or irritated, don't want to get up? Because you are on that REM deep sleep. So the first, so 4.5 hours, you're in a light sleep. That's called non-rapid eye movement. And then when you get to before your 6th hour, you're in a deep sleep. And we call that the REM, rapid eye movement. I don't know why it's called rapid, but that's because your body is trying to prepare, and that's when your eyes are moving, but then you're actually asleep. And I'll go further on the next slide, please. So yeah, the sleep has 2 phases, which is the non-rapid eye movement and then the rapid eye movement. And I wrote it down right there for you. And each cycle is about 90 to 110. That's why it's the advice is to sleep minimum of 6 hours every night, because you need to go through this cycle to have your body refreshed the next day. Otherwise, so people who sleep at 5 hours, I'm pretty sure you're very, very tired. But I know that people get up in the middle of the night and you're still in that NREM stage. That's when you go to the restroom, but then your body goes back to sleep. If you go back to sleep, it's like it's uninterrupted. But some people, they have trouble going back to sleep when they go to the bathroom, then it's gonna be totally interrupted. You're gonna start again. So once, going to the bathroom at night and going back, it's not gonna interrupt those cycles. Okay. And then the last 90 minutes, REM, I know you experience that when you're dreaming. That's when you are dreaming, the 90 minutes, which is called the rapid eye movement stage. Okay, so while you're sleeping, everything drops down. Your heart rate, blood pressure, body temperature, respiration, muscle tone, everything's resting. It is the work of what you call the GABA. So the GABA is it's a hormone that will counteract the work of cortisol. Our body is constantly our body has cortisol. It makes our heart beat, but we don't want it too much. So someone will talk about stress someday, but when cortisol levels go higher than it's supposed to be, then that's called the stress level. But we always have our cortisol, but then the GABA is gonna counteract it. That's what's gonna put you to sleep. That's why all the blood, heart rate, all that will go down. And then it also produces adenosine and acetylcholine. So they work together. Adenosine actually gives you energy, but then what happens is when you wake up, it builds up. So once your body reaches to too much adenosine, then it's gonna trigger the hypothalamus. Okay, it's time to rest. So it's not all about just giving energy. It has a purpose. When it gets tired, it's gonna put your body to rest as well. Okay, we can go to the next. So yeah, just like I explained, GABA or gamma amino butyric acid is the chemical helps to brain activity, so that puts you to sleep and calms everything in your body. And this is just the cycle. When you're on that first 4.5 hours, the GABA is up, and then once you get to the REM, which is the deepest sleep, it's gonna go down, because it's actually that deep sleep is preparing you for the next day. Like that's where the body is actually trying to fire up everything, like you're lighting a candle. That's the REM part where you are deep in sleep.
I'm having trouble hearing you.
Okay, so like the GABA is the hormone that helps people to sleep, that is produced by the hypothalamus. And it's more active during the 4.5 hours of your sleep time, because the next 90 minutes before your 6th hour of sleep, that's when you're in deep sleep. And that's when the hormones will go down too, because it's going to start firing up the hormones that you need for the next day. So like he said, your body is replenishing while you're asleep. So yeah, we can go. All right, I have not heard this ever in my life. I've heard about lymphatic system. So lymphatic is kind of like the cleaner inside our body. It's what goes through a spleen. Let's say it's the maid that cleans up inside our body. It's the lymphatic, but at night it does deep cleaning in our brain, which is called the glymphatic. I've never heard of this, and I'm glad I'm sharing it with you. So this one is the glymphatic system only happens during your sleep time, and it actually removes the hormones that is causing Alzheimer's. So that's why sleep is very important, because you're actually your body is refreshing up. And yeah, so studies have shown that people who doesn't sleep well are more prone to Alzheimer's. So it's really important to sleep. But that's the name of the waste that takes amyloid beta is the proteins that cause Alzheimer's. And with the lymphatic cycle, it's doing a deep cleaning through the cerebrospinal fluids, the clear fluids inside the brain. That's the one that's trying to get rid of the proteins, including the amyloid beta, which is known to cause Alzheimer's. Okay, so sleep problems are mainly the insomnia and some sleep apnea, but the complications are these three: diabetes, obesity, and depression. That's the complications of people who do not sleep well. And we can go to the next element further. So just like I said earlier, our body has cortisol. It produces cortisol to make our main organs function, our heart, our digestive system. But then too much causes blood pressure, increased blood pressure. Because when you're in stress, the cortisols pile up, and that's causing, you know how your veins, when your blood pressure is constantly high, the pressure inside your veins constantly, it will damage those, it does damage those veins or arteries. And then that's when, have you heard of arteriosclerosis? Yeah, those are the main reasons why you heart disease, because too much cortisol going through. And what comes along with cortisol is blood sugar. Whenever you're in stress, your blood sugar is up, and that having a high blood sugar damages the arterioles as well. So too much cortisol, that's diabetes. So yeah, we can go to the next slide. Okay, so I mentioned about the diabetes part. If you have too much blood sugar, your pancreas will be trying to secrete so much insulin. But then for people who has this problem, obesity, extra fat cells in the blood blocks the entrance of insulin to the cell, because insulin is the key for pushing blood sugar into the cell. We don't want that blood sugar running to the bloodstream, so we need insulin to push it. But then because obesity, the extra fat cells block that little little let's say where you put the key into the cell, so all the sugar is out there, so it's not good. So that's why obesity is one of the problems with sleep deprivation due to hormone imbalances. And if you know, leptin is a hormone that makes you full, that keeps you, so whenever you eat, hormone leptin is the reason why you think you're full. And then we have the ghrelin, that's the reverse of the leptin. And not sleeping well, you'll have hormone imbalances because your body has not refreshed. So it's all over the place. Your body just like produces hormones that you really don't need at the time. So that's one complication of not sleeping well. And then you can next. Okay. Oh, I talked about diabetes. So I think I went over this already, the diabetes. All right, depression. So depression is caused by reduced serotonin, norepinephrine, dopamine imbalance in the key neurotransmitters. Just like how we started today, if you don't sleep well, your body is not able to prepare on producing the certain hormones that you need. So those are the imbalances. That's the complications of not sleeping: depression, obesity, and diabetes. So earlier he asked, what why do you think you sleep? Someone said to prepare and restore. You were right, because like it's the cycles in the sleep. And someone says you like it because you feel good after sleeping, correct? And then the body demands it. It's because of the hypothalamus. It's kind of the program of the hypothalamus. It needs to get done. It has to be done. It's part of our cycle. Okay. And
There's many health benefits to sleep. Getting enough quality sleep is essential for overall health.
What's here? It's
There's many health benefits to sleep. Getting enough quality sleep is essential for overall health and well-being. It can help you strengthen. Getting enough quality sleep is essential for overall health and well-being. It can help you strengthen your immune system, boost immune cell function, reduce inflammation, and enhance recovery. It helps maintain a healthy weight. It balances hunger, hormones, supports healthy metabolism, and encourages physical activity. Lack of sleep can increase cravings for high-calorie foods, disrupt insulin sensitivity, and contribute to weight gain over time. It also helps reduce stress levels and enhance your mood. It regulates stress hormones, restore brain function, and reduces anxiety. Sleep helps control cortisol, the primary stress hormone. When you're sleep deprived, cortisol helps stay elevated, increasing feelings of anxiety and tension. Adequate sleep helps cortisol in check, helping you feel more relaxed. Sleep also allows the brain to reset, process emotions, and clear out toxins. And then some more health benefits of sleep. Sleep is essential for reducing the risk of chronic diseases and improving management. It helps with improving heart health. It reduces inflammation, improves blood vessels function, and supports heart rate. It also helps with lowering risks of chronic conditions such as type 2 diabetes. So it supports the body's ability to regulate blood sugar, insulin, and metabolic processes. During sleep, the body enhances its ability to respond to insulin helping cells absorb glucose more efficiently. It also helps with heart disease, supports by regulating blood pressure and promoting healthy blood vessels. During deep sleep, blood pressure naturally drops, giving the heart and blood vessels a chance to rest. Sleeping more also helps with strokes. Sleep supports by promoting better blood circulation and reducing inflammation. Good sleep avoids the blood vessels from thickening and clotting. When one lacks sleep, it can lead to abnormal clotting, which may block blood flow to the brain and cause a stroke. Sleep helps control inflammatory markers, which contributes to artery damage and blood clots, both of which can trigger a stroke. Okay, and some habits you can get into to sleep better. Developing healthy habits is essential for achieving restful and high quality sleep. By making changes to your daily routine, you can enhance your sleep patterns and overall well-being. Some effective strategies to promote better sleep are maintaining a consistent sleep schedule. Go to sleep and wake up at the same time every day to regulate your body internal clock. Pick a sleep and wake up time that works for you and that allows you to sleep for 7 to 9 hours. And having a comfortable sleep environment is also really important. Have your bedroom quiet, dark, cool, and relaxing. The ideal sleep temperature is around 60 to 67 degrees Fahrenheit. A cooler room helps trigger the body's natural drop in temperature, which promotes deeper sleep. Control the light exposure, reduce the noise, and you can use relaxing scents like lavender and sandalwood. Managing stress and anxiety is also really important. Practice relaxation techniques such as journaling, deep breathing, and mindfulness. A deep breathing technique you can try is the 4-7-8, which is when you inhale for 4 seconds, hold for 7 seconds, and exhale slowly for 8 seconds. This helps reduce stress and slow your heart rate. Journaling may help release worries. You can write down any stressful thoughts, worries, or create to-do lists before bed. This helps clear your mind so you're not overthinking while trying to sleep. And then some more habits to sleep better. Being mindful of foods and drinks. Avoid alcohol, caffeine, spicy foods, and heavy foods that are high in fat, spice, or protein. Foods that help boost melatonin production, which helps make it easier to fall asleep, are tart cherries, bananas, walnuts, almonds, and oatmeal. Foods with magnesium that help relax muscles before sleep are spinach, leafy greens, and pumpkin seeds. Incorporating regular exercise is also really important. Engage in physical activity during the day, but avoid intense workouts within 2 to 3 hours before bed, as they can raise heart rate and temperature and body temperature. Exercises you can do are aerobic exercises such as walking, jogging, cycling, swimming at least 30 minutes for most days. Yoga and stretching helps as well. It helps release tension and prepare the body to rest. The ideal time to exercise is in the morning or afternoon to boost energy and sleep quality.
So just like anything else in life, sleep can also have its complications, and signs of this are difficulty falling asleep or staying asleep at least 3 times per week or 3 months. This could be a sign of chronic insomnia. And then other struggles are struggling to stay awake during the day, during daily activities, even after a full night's rest. That can be excessive daytime sleepiness. And then another sign of sleep complications could be snoring loudly, choking, or gasping for air during sleep. This could have to do with insomnia or sleep apnea. It could lead to that. And as well as increased irritability, depression, trouble, and concentrating or memory problems. These are all signs of sleep complications, and they're signs that you should seek professional help. And people who you could contact are primary care specialist and sleep specialist.
That's it. And that's it. Okay.
Thank you.
Thank you.
Ask if anybody has any questions. Any questions?
You know, UC Davis, other than the sleep apnea program, other sleep programs?
The second.
What's the question?
Does UC Davis, other than the sleep apnea program, offer other sleep help? Do they have other programs? Sure.
I know Kaiser does, but that's for, yeah, for their patients.
What things do they offer?
Sleep, they offer, they send these kits to to their patients and attach it to themselves while they're sleeping
Oh,
for a sleep study. Any more questions?
No.
Nope.
Okay.
Okay, thanks for
Thank
listening.
you.